Okay, so we're live. This is going to be a little bit of a different type of content than I normally do, but I want to introduce you guys to Dr. James Hogan, who I started working with now 5 or so years
Yeah, five
ago.
or
And
six years, I
uh,
think.
and so, for me, I'll kind of just give a preface as to how I found you. And, I was about to be 30 and I had, all these like sort of knots and sort of energy leaks. I had just had surgery maybe 8 months before on both of my ankles and was having a difficult time, uh, after the rehab process, like getting my body back to the condition that I wanted it to be in. And so you and I worked together, and the reason I found you is I felt like acupuncture was going to be like the thing that I needed. And
Hmm.
so like dry needling was like
Yeah.
one of the at the clinic you're at was like one of the service lines. So I was like, okay, I got to go check this out. And in even in your first assessment with me, you challenged my idea of what physical therapy and what a PT can do.
Hmm.
And I want to talk about that today because, for me, I have a passion for athletes, and, athletes, die twice, right? You kind of lose your ability to be your best athletic self at
Yeah.
some point. And then, you're a weekend warrior and you're just trying to, have a good time doing what you used to do, and you find yourself like jammed up or not feeling well and like not able to adapt. So before we get into that though, just, introduce yourself and, tell us a little bit about, who you are and your background.
Yeah. So I'm Dr. Hogan, or just Hogan, I usually like to be referred to. And I am classically trained as a chiropractor, but I don't really hang my hat on that. I focus more on the rehab and the training and the movement aspect of what goes into taking care of the human body. So, like, I do adjustments, I do dry needling, I do cupping, I do all of that. But I wouldn't say I don't care for it, but that's not the focus. The focus is always on moving the body, increasing its ability to function and create strength and move well and like move with confidence. And so just a slightly different emphasis, but still having all those other tools, but really focusing the center on the moving and the training and the adaptation that the human body is capable of. I got my undergrad degree from Texas A&M in exercise physiology, and then got my chiropractic degree from Parker. And I've been practicing in the Dallas area for about 10 years now. Yeah.
And I think when you hear chiropractor, you kind of jump to your traditional,
Hmm.
adjustment, back crack, neck crack, whatever, and kind of send you on your way. And when I encountered you, I was looking for somebody who was, more on the dry needling side, and like that was kind of one of my criteria I was looking for. And then, the looking at you and the way that you practice, basically your clinic is in a weight room. And so I was like, okay,
Yeah.
this has got to
Yeah.
be the right way. This has got to be the right guy
Yeah.
to
It kind of
find.
sets the
So,
tone, which I
and
love.
it does. So it's like, I was expecting kind of walking in, getting laying on the table, getting the adjustment, having the conversation of, some of the little things that I could do to help, kind of solve my issues. And really, at the time, I didn't really realize that I was looking for a quick fix,
Hmm.
and the solution to kind of getting not only the pain relief that I was in, but also changing and strengthening my body to be able to adapt to, being in my 30s and like not being the same athlete that I was prior, but also identifying areas that I was just kind of pushing through as a young person because my body would adapt, that now it's not able to do. And the biggest thing is I walked out of that first evaluation with like a whole page full of homework that was basically like strength workouts. So
Yeah.
it was like
Yeah.
totally challenged my assumption of what a chiropractor is.
Yeah. I remember, if it's all right if I like talk about your case a little bit. I
Sure.
remember when you came in, and there was the ankles, it was also the hip. And you came in and, like, honestly, we just talked for a long period of time, which is way undervalued in a lot of exams, is just kind of talking to the person. And I remember you expressed that, like, you wanted to continue to dunk. And I remember we had a conversation somewhere along the lines, and I'm like, look, like, dry needling is not going to prepare your ankles to land from a dunk. Dry needling is not going to strengthen your hip to be able to get you up there and let you land safely. And so I think we even spent a lot of, like, a good portion of that visit just being like, look, we'll needle some stuff, but that's not going to get you to where you want to go. And then so we kind of had to, like, shift gears in your mind and be like, oh, okay, like, yeah, like, I have some pain and dry needling can help with that, but that's not like, it's not like a needle's going to go in there and just like, oh my God, my ankle is so much stronger now. Like, it's like, okay, now I actually have to like load the tissue and get this ankle used to like cushioning that landing, and I got to get that hip to function the way it is. And I see that all the time where people come in and they're like, "Oh yeah, like I saw you do cupping," and I'm like, "Okay, I'm glad you're here, but like why do you want that thing, right? You don't want the thing just because it's the thing. You want it for some other reason, and having to get beyond that, and that's really exciting. Like you even yourself were like, I want to dunk, and I love when people come in with like a functional idea. Like they're not like, hey, I want to just get out of pain. Like that's cool. Like I'll help you. But whenever someone comes in, it's like, man, I want to dunk, or hey, I want to run a marathon. I'm like, cool, that's the goal, right? The treatment's not the goal. The thing is the goal. And getting people to understand that sometimes almost you can like see their mind just kind of like explode when you say that. And it's like, this pain is just a small piece. And working with you was great because like you got it really quickly, and that just made working with you like so much more fun. Some people it takes a little while for them to like shift their mindset into that mode, but it's a blast when they finally happens.
Well, I think you also really like heard me. I think that was a really important part of our kind of like patient relationship, a patient provider relationship was like,
Hmm.
yeah, I did want to dunk. And not only did I want to dunk, I wanted to dunk well and without pain. Because like I could, at the time, I had the physical tools and like my body remembered how I used to explode and dunk, but I would always end up like worse off than after I'd go for like a basketball session. I'd walk away from that worse than when I walked in from the way that I felt. So I knew I had to adjust. And I think my background as an athlete, and I want to get into this a little bit with you as well, because like when you think of strength training, or when I think of strength training, you think of your macro lifts, you think of your gains, you
Hmm.
start to see tone, you start to
Yeah,
see some mass gain, you
all
start to be able
all
to hit,
barbells and heavy stuff,
yeah,
right?
pumped up,
Yeah,
and you're hitting PRs, you're
crushing it.
feeling like you're growing, you're crushing it, right? And so many of the movements that you gave me in my homework, really I had to change the way that I looked at measuring success, right?
Hmm.
So back to my initial case, like I had almost no internal rotation and very little external rotation on my hips. And I didn't even realize, like I've been taught, kind of my whole athletic career not to overextend and like just to keep everything kind of in a straight line. And that was really limiting my ability to move. And, sure, I could hit some numbers on lifts, but my body was working against itself. And but throughout that work, over years, it took me years of doing a 90-90 drill that you prescribed me on day one before I was able to do it just the way that you're supposed to.
Hmm.
Like just finally getting into the actual like full range of motion. So like how do when you're diagnosing patients or when you're kind of prescribing the homework, so to speak, like how do you measure that progress over time? Because it's like the not sexy lifts. I wasn't throwing up
Yeah,
big numbers
yeah,
on 90-90. I was like just like, hey, I can now sit on the floor balanced.
yeah. I mean, there's a lot of like really obvious measurements, right? Like when you're talking about range of motion, it's like, yeah, you can measure it, of course, but like that's that's to me like the least sexy stuff. Like the biggest, I think one of the best ways to measure improvement in something like with your case is just like confidence, right? Like how confident do they feel, or how confident do they look whenever they do both the homework I'm giving them and then whenever they go do the thing afterwards. And so that's something that's kind of hard to measure and kind of takes like you have to be cued into that. Like there's no scale. I mean, I guess you could try and scale it 1 to 10, but like it's I don't know that I've ever asked anyone like how confident do you feel doing that? But like you can see when someone does it that they're just like, like the first time you get into a 90-90, like you're like what the hell? Like and you're just like, man, this feels awful. And then like yeah, that range of motion might even still be the same after doing it for 2 or 3 weeks, but just seeing you get into it and like how smooth you get into it and just like can you push it and like how connected are you to that range of motion. There's all kinds of these like small little contextual things you can use to measure that progress. And another part of that, like with the confidence, is just like how does the patient feel about their possibility in the future of the outcome, right? Like when you first came in and saw me, like man, you didn't sound like you were really confident that you were going to be able to get to that point of yeah, being able to dunk. And then like the second time I saw you, like yeah, like the hip and the ankles hadn't changed much after 1 week, but how you talked about it and how you felt the possible outcome could be changed dramatically. And so like physically, not a whole lot of change, but like up here, you'd already changed like miles. And like that change in mindset is just as important in a lot of people, and I would agree, even more important, especially in like chronic conditions than what you're doing physically. And so I named my clinic Agility because I think agility kind of characterizes a lot of things I'm looking for. Confidence in movement. It requires speed, it requires strength, it requires coordination, but agility also applies to having like an agile mind. And like that comes to me
Hmm.
understanding where you're at and what you want, but it also implies the patient being able to like change their own mindset to new information and like the confidence aspect of it. And so there's so many things you can measure. And I just think the mental game is such a large part that's often missed and also hard to contextualize. But when you see it, man, you see it. And you displayed it really well just from like 1 week. It was awesome.
Well, I remember too, like I think that confidence comes from, in any part of your life, you gain confidence from like achieving a little bit of success or progress. You start to
Mm-hmm.
feel like, oh, okay, like this is working, or I see now like how this works. And I think coming to you at that point, I had tried a lot of things on my own and they weren't working. And I just kept working myself into more pain, or like, continuing to like, have physical gains. I was training at a big box gym at the time. I was doing well. I was putting up numbers, but my body didn't feel right.
Mm-hmm.
And I think, agility is a great term because you have to be kind of ready for unexpected things.
Yeah.
When you jump,
Mm-hmm.
if especially if you're playing with other people, and you make a big jump and you get bumped, you have to be agile enough to land in a off balance situation and not hurt yourself. And you want to do that, and your body's got to be able to move and contort itself to adjust for those things. And I think that's a good segue really to talk about adaptation, and not just adaptation to training in like a positive sense, but the body's adaptation to sort of our lifestyle that we live, in modern day sort of corporate America style, of sitting a lot during the day.
Mm-hmm.
And then, if you're a weekend warrior, you're going before or after work and you're like doing heavy lifts or pushing yourself, and then going immediately sitting back down, your body's going to adapt to that in a suboptimal way.
Yeah. Yeah. And like we were kind of talking earlier before we started this about how the body has this amazing ability to adapt to whatever you ask it to do. And so kind of everything you do is sort of this little communicative process with your body of like, okay, I need this ankle to move this way a little bit more, or hey, I need a little more range of motion here. And that amazing adaptive process is like the cornerstone of like rehab and like training. But the kind of the point I was getting to with like everything's a communicative process with the body. And so like, yeah, like sitting here right now, I'm communicating to my body that like I don't need to be able to support myself standing for very long because I just sit down all day. And so it's a double-edged sword. But I think what most people get lost on or get confused in is that like they think that adaptive process, like, man, I gotta train for hours and I gotta like grind and sweat. And it's like, no, like that communication doesn't have to be this like I don't have to like force my bodies to submit. Like it can be this like gentle kind of process where you just like accumulate some time in there, and all these like maladaptations of like sitting and all this static stuff can easily be fixed with just a little bit of work. And like if you want to do more, great, but like the minimum threshold is way lower than people think. And I think a lot of practitioners sort of like fail to get that buy-in of just like, hey, let's baby step it, let's just can we get a little movement here, can we get a little movement there. And the thing I love and I kind of consider like the foundation for all of it is it comes from a system functional range conditioning, and they teach what are called controlled articular rotations, or CARs for short. And I know I gave you a
I
ton
knew we were going to talk about
I gave
cars.
you a ton of these, and I love these because it's a great way of it's a great system that if you do it well, it kind of just checks all your movement boxes, and it's easy. You don't have to like I gotta stretch this thing for like 30 minutes today, and then I gotta stretch this thing. It's no, just you're just gonna work through that whole range of motion. Like boom, I just did one, right? That's it. I just did everything my shoulder can do, and it was really easy. And like yeah, like I can put some particulars to it, but it's that simple, right? Like your body adapts to what you ask it to do. And if you can get a little more movement through your day, boom, that's it, right? Like that's easy. And then from there, like, yeah, you want to go more, like, bam, I got tons of things we can do. But just having this little system that I think cars fills the role perfectly for, where you take the joint, you move it through its full range of motion, you do it 3 or 4 times, it takes like 1 or 2 minutes per joint, and you can just go like neck, shoulder, hip, knee, ankle, boom. Like I did mine this morning. It took me like 10 minutes. And I'm like, cool. If I do nothing else today, I have told my body that I need to take care of my neck. I need to take care of my shoulder. And getting out of this mindset of I got to go to the gym, I got to sweat, I got to grind to like make any progress. I feel like that kind of scares people away from it. And so kind of like meeting people where they're at, and like some people want to do that stuff. Some people like just need those check boxes. And I love cars, man. I could not say enough good things about them. And without getting too into the sciencey details, like man, all that tissue around the shoulder covers all of it. It's awesome.
Well, I think it's a real mindset shift too. You and I are about the same age. We come from like the last generation of the bro science, where,
Bro.
we didn't have a whole lot of research, in the, both even like for me, like
Yeah.
even in my college, like highest level
Just
of my athletic
getting my
career, we were
workouts out of
just
like muscle and fitness magazines. Like what's the Olympia guy doing? I'm gonna do that. Like, yeah.
Oh, and like, back to the adaptations, I just like cringe when I think of how terrible my squat form was, just
Hmm.
piling as much weight on it as I could, deadlifts, power clean, same thing. When you're 20 years old and, if and you got so much growth hormone and testosterone,
Yeah,
like your
dude.
body's going to adapt, and like any input is going to result in some sort of like increase. But, for me, like doing longer term, honestly probably more damage if I had just done like cars and lunges. Like I probably would have gained like more, actual functional strength
Hmm.
that set me up better long term, because it was a mindset shift for me to say, oh, well, like, all right, I did my cars, like that's what I have to do today. That's my prescription, because it wasn't throwing a bunch of weight up. It wasn't a huge caloric output. Didn't take, I didn't have to go to the gym to do it. And I don't know. It really did change the way that I thought about my training.
Yeah. And I kind of want to, like you were talking about, we're young and we're just like taking these workouts out of magazines. And something you also said earlier, you were talking about like, everything's got to be like neutral, right? Like I don't want like,
Right.
there's so many myths and misconceptions that have kind of become popularized, and some of them have kind of gone by the wayside. Like, like knees shouldn't go over toes. Like that's an old one. Now there's I mean, most people have heard of knees over toes guy at this point, and he's right. Like there's zero evidence that says your knee going over your toe is going to be bad for you. I think one other one that is we're starting to see some more pushback on it, but like the flexing your spine. Like so many people are just afraid to flex your spine, and especially like under load. And if you've never flexed your spine under load, yeah, don't flex your spine under load. But the idea that you should never flex your spine is crazy. It's absolutely crazy. Like you need to like the spine has all these different segments and they're all made to move for a reason. And so you're starting to see more people get away from this idea. And I'm huge on this. This is a big one for me. Stop making people afraid of moving, right? And so people
Mm.
were scared for the longest time to push their knees out over their toes. They were scared to squat really deep. They're scared to flex their spine. And the idea that that's going to protect you, well, your spine's going to flex at some point. If you never train that position ever, and then you do flex your spine and then you get injured, what you should take away from that is, oh, that's because I've never done that movement before and I intentionally avoided it. But what most people take away from is, oh, I flexed my spine and injured myself, therefore I should never flex my spine again. And that so then they create
Right.
that fear around it. And so going back to like the confidence in movement, like that's a big part of it. And that's being excited to explore the range of motion as opposed to being like, oh no, I can't do that because it's bad for my knees, my hips, my back, or whatever. It's like, no, maybe you just aren't prepared for it. So we start with something a little easier, which might just be a controlled articular rotation. That's a great place to start. And so getting people moving and like breaking some of those like fitness myths pushed by physical therapists, chiropractors, trainers, whatever, is paramount. It's important. Like I need there need to be more people out there And there need to be less people on social media pushing those like myths of like, and then like the idea like, oh, if I sit like this all day, I'm gonna like my neck's gonna explode. Like, no, do your cars, and then like when you text, yeah, you can do that because you already put that input into the system. And so I don't even know where I started with
I
that, but
no, this is great because I think you're talking about like you get the ads or you see the social media posts
yeah,
are like don't get nerd neck. It's like okay,
yeah,
well we're all kind of like sitting
tech
down,
neck, text neck, tech neck, one of
yeah,
those, yeah.
and so for me like yeah, I'm a tall guy. I've always like even my dad used to make fun of me when I was a little kid because my head is heavy and I kind of like sit forward a little bit. He's like, yeah, if you do that, you're going to be leaned over your whole life. And what I realized, like, even working with you, always my coaches would tell me get low or like, and I didn't even know how that went or like how I was supposed to do that. So like I didn't have the hip strength or mobility or range of motion to get down into an athletic stance the
Hmm.
way that somebody who was maybe more, athletically gifted would do. So I leaned over and then that caused me to think I was low, but I was not in a way that I could move. And so, like, for me, going back to like, your sort of core principles is like applying strength through that range of motion, time under tension, whether
Hmm.
it's hips, spine. I basically just realized I had no strength in my T spine. I had never used it.
Yeah.
I just basically sat there for my whole life. And so, okay, well, now I need to just go through and activate it. Let's do a Jefferson curl. Let's do some cars. Let's like do some cat cow, some down dog. Like really simple, like, anti bro science, like yoga moves, basically to just wake up my body.
Yeah.
And like, then you see over the period of even just a couple of weeks of just doing it a couple times a day, you start to really notice and see that difference just because your body it's awake there. You start to be more mindful of it. What does a dog do every time they get up from a nap? They
Oh
hit a
yeah.
quick down dog, up dog.
Ooh, big
Just a quick
stretch.
little
You
stretch,
know,
just
you
to,
gotta say it.
yeah, big
If you don't
stretch.
say it, you're
Yeah,
like a
you
war
do.
criminal, I think.
That's exactly right. You got oh, big stretch, and right then they're right off to it. Even if they
Yeah.
break into a sprint right there,
Hmm.
they're ready to move.
Yeah,
So you make it.
that's something I like to call cold mobility, right? The ability to just like get up and do the thing. I was a CrossFit coach for several years. Loved it, loved CrossFit. And I remember there are plenty of guys there. So a muscle up for people who don't know what muscle up, like you're hanging down and then you like come up and you do a dip. It's a very large movement, very demanding on the shoulder. And there are a lot of my athletes who, they'd come in and they'd be like, "Oh, it's muscle up day. Like I need extra 30 minutes to warm up." And I'm like, 30 minutes? Like, that's crazy. And they're like, yeah, I can do a muscle up. I just got to warm up for 30 minutes. I'm like, well, maybe you shouldn't do that. If it takes 30 minutes for you to warm up, maybe there's some other
Mm,
stuff you should be working on. And so, like, I'm a big fan of the cold mobility, right? I can just get up and do the thing. Now, I'm not saying, like, if there's a workout with 30 muscle ups in it, just don't warm up and go do it. But doing one or two from a cold position shouldn't wreck your day, right? You shouldn't do like, oh man, I did a warm muscle up without warming up. Like my shoulder's going to be pissed for a week, right? Like if you maintain that mobility and you like do things like cars and you just move well in general, you should be able to like get up and do some kind of athletic things without having to warm up a ton. Just to be clear, everyone warm up well. That's a good idea. But it shouldn't ruin your day to like get up and down off the floor without warming up. And so the cold mobility is always the goal. So that's just something that a well-maintained body should be able to do. Some things that most people would be like, man, I don't know about that, right?
and I'll even take it a step further. Even things that are like not athletically impressive, like slipping on the ice and like
Yeah,
catching yourself,
yeah,
or like stumbling on stairs and just your body being able to catch yourself, and you're not like, oh, my back's wrenched, I'm gonna be like out for a week. I think that to me was one of the most like practical examples
hmm,
of after really working on range of motion, really digging into like hips and ankles and like connecting my body. I slipped on the ice at one point a couple years ago. Not that much, just like a little bit of
just
like
just a little
hydroplane, and
like
then my foot caught.
yeah,
Yep, and then I caught, and I was like, oh man, if I hadn't have been doing this work, I would be like walking sideways for the next 2 hours, or I would need to
yeah,
go to the chiropractor to get an adjustment. It's like, oh well, my body was able to catch itself because I had explored the range of motion. I was ready. I was cold. I didn't need to warm up, and
yeah.
I didn't, I wasn't debilitated.
Yeah, that's a that's honestly probably a better example than what I was talking about. That's actually perfect. And like,
Yeah.
that's,
Well,
that's what
yeah,
I
because I
want.
feel like
That's what I
most
want.
people aren't. Yeah, and like even more recently, like I have to remind myself, like being really present in these moments of like, man, I have come a long way. I was flying on a crowded plane, didn't get like the typical exit row that I like to have, and so I was in a window seat in a regular like coach seat, and for
Yeah.
me that is tough.
Yeah. That's tough for
But
tall
my
guys.
tall guy, and I got the backpack under the seat, all this stuff. So like I'm sitting there, my hips are both fully externally rotated. I'm sitting straight up for 2.5 hours, and I was like, I don't have any pain. Like I'm able to adapt to this position.
Yeah.
I'm not comfortable,
Yeah.
but I'm not in pain, and I'm not. And I got up and I walked out off the plane. I was like, you know what? I'm not even jammed up. I could go, work out right now.
Yeah.
And I was like, man, that is just the most tangible example I can find of how far I've been able to come because when I started working with you, my hips like wouldn't even externally rotate at all. Like I remember like multiple milestones over the years of, oh man, I just reached a new level of rotational capacity, I guess you would call it, that I didn't even have before.
Yeah, no, that's actually like the perfect term for it. Rotate capacity, right? The ability for your hips or your joints or whatever to do the thing. And so a lot of times when I'm talking to my patients, I'm like, look, we're just trying to build capacity, and that might be strength, that might be stamina, that might be just pure range of motion. But the goal is for it to be able to tolerate the thing, whatever that is. And sometimes that looks like a back squat. Yeah, we need to build some more strength here. Sometimes that looks like, hey, I'm going to have you stand on a leg, just stand on that one leg for a minute. And some people that completely just smokes them. But I think, you describing being in that uncomfortable flight and then just getting up and being like, man, I feel great. Like that's the perfect example. The number of people I see who are just like, oh, had a big flight last week, my back's killing me. And I'm just like, dude, did you do the things that we talked about? And they're just like, oh, no. I'm like, there you go. Like, come on, you gotta do the stuff. You gotta put in the work a little bit.
Well, I will say it's a mindset shift. 'Cause I walked out of that like, the first, throughout our sessions, I was like, okay, well, I wonder what homework I'm going to get and then if I don't do it, like I'm going to come back here and like this was basically for nothing. Like, it's
Hmm.
like, okay, you can fix me up, you can crack me, I'll feel a little bit better as we walk out. But if I'm not doing this work, and that's what it really connected, and just for people listening, we haven't worked together in many years, but in some ways I've worked with you every day. We're
Oh, that's
still,
warms the
and it's
heart right
like,
there.
so right, like, so I mean really you gave me a program like honestly, like if I just stick with this and I'm consistent. And I think another thing that for me as an athlete was very difficult is like I wanted to get to the big lifts, I wanted to get to the big milestone moments, but I had to change my idea of progress
Hmm.
to being like, all right, well, no, I just need 10 minutes of cars today. I just need to really get into my 90/90s. I really need to work on my couch stretch. I
Yeah.
couldn't even put my knee on the ground on my first couch stretch when we first started working together, much less fully like flexed and extended hip and quad. And now I'm like, oh, well, I wonder what I would have been like as an athlete if I could have done this in my, when I in my early 20s.
Yeah.
Like I just wasn't, didn't have the awareness and didn't have the coaching and movement prep to be, a great athlete. And you were talking earlier about knees over toes guy is kind of challenging the long, kind of held norm of like your knees shouldn't go over your toes. But when you look at the best athletes, they're in these amazingly fully
Oh
flexed
yeah.
extended positions, like, and they're, just naturally sometimes.
Yeah, they do
But it's
ton
like,
they do
okay, well,
tons of
if the
stuff
if
that's like bad, but then they're like the best in the
right.
world at it. And I don't know how people look at that and then like demonize this certain position because there's some test that says, oh, if this hurts, then okay, then we should just avoid it altogether. And that's crazy, right? If something hurts, maybe we should get stronger there instead of just being like, nope, never touching it again. Maybe we should like try and drive
So
some
you just
adaptation there.
you hit the nail on the head. So that's what I want to get to now because I think I'm 35, so when I am really training hard or like playing a lot of basketball at a high level, like injuries and things happen, like you bump into people and all those things. But like for me now, exactly what you said is like if I have pain in like my like a muscle pain that
Hmm.
previously I'd be like, oh, I need to go get dry needled or I need to go get an adjustment. My next question is like that I ask myself is like, okay, well, how can I work through this with a strength movement? How can I
Yeah.
like let me do my cars, even if it's like, I'm in my office and I'm like, my shoulder's feeling a little bit weird. Let me just explore with the cars. And almost 10 times out of 10, if I just take 15 seconds to do that a
Yeah.
couple of times, I feel better afterwards. And then it's like, okay, well, let me add that to my training regimen. It doesn't have to be big weight. It doesn't have to be
Hmm.
an entire program. Just being a little bit more mindful and kind of tweaking that.
Yeah. Now, I do want to like put on my doctor hat for a second. Just like when you have pain, there are sometimes pain that you need to avoid. That happens. There's certain things, and that's one of sometimes why you need a professional to like examine some things, make sure that's the case. Now that we got the disclaimer out of the way, that is the perfect example of what I want people to like, what I would want people to embody, right? Like I want people to feel confident in that, like, hey, oh man, my shoulder's kind of hurt today. Let me explore that, right? Instead of just being like, oh, I gotta like leave it alone or like take some Advil or let me call my chiropractor, PT, whatever. Instead, just being like, okay, the shoulder's hurting a little bit. Say, I didn't sleep great last night. Maybe it's just that. Or like, oh, if I do this, it's okay. Let me just try and work it a little bit. Does it get better? Yeah. Okay, cool. I'm good. Like, a large part of treatment for me, and this is one of like the cornerstones of my practice besides movement, is education. And I think you're a perfect example in that like now you understand things so much better that you feel confident enough that like when you have that little ache or that pain, you're like, let me try moving the area a little bit. Let me explore it a little bit, right? Like you better understand now that pain isn't necessarily something that I have to avoid altogether, right? Like no one's pain free. No one. I have pains, right? It happens. Nobody is ever going to be fully prepared to avoid pain. But when I have it and when you have it, we're just like, oh, okay, that's interesting. Let me work with this a little bit. Let me see if I can figure out what's going on. Let me see if I can find a way to make this tissue adapt. And then like, yeah, if it goes on for a while, I'll give Dr. Hogan a call. But I would much rather you just shoot me a text and be like, hey, I had this shoulder thing, took care of it. It's good. I'd just be like, hell yeah, dude. That's what I love to hear. And like, that's amazing. I just hearing you say that right now, I'm like, yes, he gets it. He gets it. That's my
Yeah,
guy.
it's really interesting, man. Like the idea of work and strength into recovery. So it's like, oh, I'm in pain. I have a look, I have been wearing a whoop for like, almost 4 years now. And so it's like, I have all this data to say like, all right, well, if I really push myself, really overexert, probably going to have a lower recovery. When I have a lower recovery, my ticket to getting back into the green and back into a high recovery is work. And so like
Yeah.
getting in and exploring, maybe not overexerting, maybe not overtraining, but just getting in and kind of loosening it up, warming it up, kind of getting in, doing the cars, doing some light load, range of motion exploration. Hey, this kind of hurts. Let me explore it. Let me get in there and work it out a bit. Just touch it, just kind of like a microdose is like a popular term,
Yeah.
right? So you
Yeah.
get in there, you microdose the weight, the muscle group,
I like
and then the
that.
next day, hey, okay, now starting to feel a little bit better. So it's really interesting to me, like challenging those norms of like, rest and work. And, really it's all about movement. Like the human body, we kind of live in this modern age where, we don't really need to use our bodies too much to survive.
Yeah.
Where,
Yeah.
in the past, 100 years ago, we'd have to walk a long way and like hunt or farm or hunt our food and all those types of things where just sort of the average modality of movement was higher. And now we don't have those things. So like we have to force ourselves and educate ourselves to learn how those muscle groups work so that we can use them for longer. Because it really is kind of a, if you don't use it, you lose it type of
Hmm.
situation.
Hmm. Yeah, I want to. There are two things I want to harp on that you just said. One, did you call it a whoop? Your
Yeah.
band?
Is it what? Or you could,
It's Whoop,
yeah.
right?
Is it
Whoop.
Whoop? I
I'm
don't
pretty
know.
sure
I
it's
call it
Whoop.
Whoop. Yeah.
I had to a Whoop. Okay.
It's
Um,
my Texas. I can't get over it. It's my Texas piece.
okay. So one of the things you like talked about, and you talked about like exploring and like slowing down a little bit is, and I think we kind of talked about this already. It's just like so many people they just want to like get in there and like just hit it as hard as they can, right? Like here in Dallas, it seems like everybody's a go-getter and they're just like they're looking for the hardest, fastest class they can get. And they just want to get in and just like go as hard as they can and just grind it out. And like there's a time and a place for that, but when it comes to recovery and like the movement and like the whole environment of the body, we really need to slow down a lot. And like that goes in our workouts and in our movement. And so, one thing I like about the cars is they're so easily adaptable, right? There's many different levels to it. And so there's different levels to movement, right? Like I did one earlier, right? Like super low intensity, right? Now I can do that exact same movement and I'll get like a lacrosse ball and I'll like squeeze the crap out of it and I'll like just tighten everything up. And like I can make this really difficult, right? And so use knowing when to like push those boundaries and like push hard versus like slow down and like take a more gentle approach with it is really like that's a very difficult thing for some people to understand, and that sometimes you got to do the thing, but you got to do it a little less, and then sometimes you got to do it a little more and do that intensity, and the variability is something that's hard for a lot of people to wrap their minds out because they just want to like crush it, they just want to do the thing and just hammer it.
Right.
Like I had a patient recently who she had a stress fracture in her foot, and she's like, okay, what's my homework, what do I do? Because she knows I'm going to give her homework, I always give her homework. And I was like, nothing, leave it alone. She was like, and it just like, she's like, what? And she's like, no, like, what's my homework? What do I do here? And I was like, I don't know, move your toes. Just move your toes sometimes, and then just stay off of it. And it just like, and so she's like that real type A of like everything I do has to be full bore, full intensity all the time. And I think this has been the most. I've helped her several times throughout the years, and the hardest thing for her was just to slow down and just like listen to what her body was telling her and just be like, okay, we can't power our way through this. Sometimes we got to slow down and just kind of like listen to what the body's saying and let it do its thing and just like be a little more gentle with it. And it was so funny just watching her struggle with that.
That's a challenging thing for, especially for type A athletes, right? Like you spend your whole career like trying to advance,
Hmm.
trying to like shave seconds off of your times or, add, pounds to your lifts or, bigger achievements. And I think that for me also was challenging. It was like, I'm not going to make up all these years of, you know, not moving my body the right way with one stretch, with
Hmm.
one chiropractic session, with one adjustment. It's got to be like micro adjustments over time. That really changed my mentality as an athlete. I'm like, now I'm a different level of athlete than I was then. In some ways, I feel like I'm stronger and more adaptable and smarter. But in other ways, like, I used to, you talked about cold warm ups. When I was 23, I didn't need to stretch. I go in to jump into a game at the highest level possible, run
Yeah.
as far hard as I could either way, hungover,
Oh,
dehydrated, all these things, like no problem. And now I'm like, obviously, like those are just, mistakes of the young.
yeah.
But now like changing the way you approach that and like, okay, well, if I feel this way, why is that? Am I dehydrated? Did I get a good night's sleep? Have I moved my body in this way? Let me explore it. Let me
Hmm.
slow down and say, all right, if I want to get this PR down the road, how do I make sure that I'm prepared when that time comes?
Hmm. Yeah, preparation, right? It's the little bit of movement every day is you're preparing for the unknown and the unknowable. That's a CrossFit thing, is they're saying they're training for the unknown and the unknowable. And so that movement variation of training through knee way out over the toe, training through that spinal flexion, training through spinal extension, doing the cars, right? The idea is not to get better at the car, right? Like that's cool. If you do, like if your car looks a lot better, like I'm happy. But what makes me excited is like I know that shoulder that you've been doing cars with is going to be better adapted to whatever you want to do, right? Like whether that's baseball, basketball, whether that's like just throwing your kids up in the air, whatever. The goal with all this little micro dose movement, which I love that term by the way, is not to just do the movement. It's to help you live a life where you can just like do whatever you want, right? I like what I hate whenever I'm somewhere and like I don't know, maybe we're out on the boat and like someone's on the wakeboard or something, and someone in the boat's like, "Oh, man, I could never do that. My knee, my back, or whatever." Like I hate that. I hate hearing that fear in people's mind associated with movement or certain activities. And so that little microdose of preparation, it's more so than just doing it to like move and feel good. It's doing it so that you can live a more full life. And when someone's like, "Hey, you want to go wakeboarding?" You're just like, "Hell yeah, my body is ready for that." Like that's the
Yeah.
that's the goal. That's the sexy thing, is like just being not afraid to do whatever. And that's what I want for everybody, right?
I love that, man. I think like for me, that's a big point of pride, like being able to, somebody says, hey, let's go do this thing, and not even have to think about it. Like, yeah, I'm ready to do that. Whether it's, some sort of triathlon type thing, or going out on the lake, or playing a different sport than I normally don't play. Like, yeah, let's get out there and do it. I know I'm ready. My body's ready because I've prepared it to, be it out to slip on
Hmm.
the ice, to carry boxes upstairs, to get low and help lift something, all these different types of things. So, um, I do want to talk a little bit, because I know you mentioned it earlier. You have started a new practice,
Yeah.
agility movement. So, talk a little bit about the new practice, and how people can find you and like work with you, and what they should come to you for.
Yeah, so just opened up, wrapping up the second week. It's been great so far. Really excited about it. You can find us on Instagram. It's Agility Movement on Instagram, real easy. Email Dr. Hogan at agilitymovement.org. We're located here in East Dallas, inside a fitness studio called Wesley Wellness, which is an awesome place. I treat people for anything, and what I really want to stress is like, just because like if something doesn't hurt, and you just like want to move better, you want to work on um, creating that confidence within your body. Like, man, I get more excited for that than like someone coming in with an achy shoulder. So we can work online, we can work virtually, and create programs for really just about anything. So yes, if you've got, if you're post surgery, pre surgery, if you've got a stiff back, a shoulder, any type of musculoskeletal ache or pain, absolutely, I want to work with you. I want to get you out of pain, but I also want to take you that step further and get you to where you're just like, man, my body feels good. I can do the thing. I'm feeling awesome. And I want to get everyone to where you're at, where you're just like learning to like explore and move your body and like understand how adaptive and how awesome it is. And so, you know, anything you got, I can probably help you out with it. And then, there's some things that are out of my wheelhouse, and I'm happy to send you wherever you need to go. But, you can hit me up on email, shoot me a DM on Instagram, and if it's a great fit, hell yeah, let's do it. Like, I am up for anything. So, hit me up. I'm looking forward to helping people out.
Yeah, man. Well, again, I have benefited greatly just from like, I think it's like a gateway drug to like this whole extra career that I've been able to have. And I think, when I had my ankle surgery, one of the things I told the doctors was like, I know that my peak level of athleticism, like I don't want to have to worry, or I know that that's behind me, but I want to be able to, have fun, get up and down, and, when I have kids, be able to chase them around without pain. And like that was my level of expectation of what that was going to be, and you and our program and our work together really opened up an entire like middle ground between that.
Yeah.
I'm not jumping from the free throw line and dunking on anybody anymore. I was never really doing that,
Yeah.
but pretty close. But at the same time, I'm surprising myself, and learning and exploring, and also getting to show up. Like my guy LeBron says, the best ability is availability, and
Yeah.
my body is available for me to do whatever I
Dang.
want. Go play
Yes.
18 holes of golf,
Dang. I like that.
and
I'm stealing
then go
that.
for a
That's
run. It's
good.
nice.
Yeah.
Steal it, man. It's
Done.
good. So yeah, again, like you introduced me to that entire like journey, and so I'll send as many people to you as I can.
Yeah, man, just hearing you say all that really just like made my day. That was awesome. Like, glad to hear it.
Well, cool, man. Well, yeah, I know this is going to help some folks, and I can actually go stop the recording here.